Hi, I am Sunil Reddy. I'm here to talk to you all about your upcoming knee replacement surgery. I would like you to know what goes on inside the operation theater, and then we will talk about your recovery process and your rehabilitation. And then I'll come to the various other aspects of knee replacement, including what are the benefits of the surgery, and then lastly we'll touch on the risks and complications we might encounter. So the knee joint moves like a hinge. It can move only in one direction. It has got the femur or the thigh bone at the top, the tibia or the shin bone in the bottom, and then you have the patella or the kneecap. So when it comes to knee replacement, many people tend to think that we have to chop off large chunks of bone. But however, it is truly just a resurfacing procedure. As you can see, the knee replacement has got a metal plate that goes on top of and inside the shin bone. And then there is a plastic part that goes on top of this tibial component, so to say. And then there is this metal bit that goes at the end of your femur or your thigh bone. And that is how the metal articulates with the plastic. So now coming to what these components are made of. So most of the metal components in any knee, hip or shoulder replacement across all types and various brands are made of an alloy either of cobalt and chrome or an alloy of titanium. And the plastic is made of a medical grade polyethylene. Now let's go to the operation part. First, the anesthesia. The surgery is often done under a spinal anesthetic. So this is the part where the anesthetist gives an injection in your back to numb you from waist down. This is our preferred mode of anesthesia because it is quite safe and also allows for prolonged period of pain control over the next 12 to 24 hours. The other type of anesthesia is a general anesthetic. Your anesthetist can speak to you if this is your preference or if he or she feels that this is in your best interests. Once in the operation theater and you're comfortable, we make a cut or an incision in the front of your knee. And once this is done, we split the tendon and move the tissues and the kneecap or the patella out of its place to access the knee joint. So as you can understand, we don't cut through or cut across any of the muscles or tendons. We often use computer navigation or patient-specific technology. So that might mean that there are some temporary pins placed in your shin bone or thigh bone that come out at the end of the procedure. And once the cuts, as I have explained before, are made and the components go in place, we insert a tube called a drain to remove any excess blood. Typically, once the surgery is finished, we close the wound and you go to the recovery. In the recovery, you would stay for about an hour to hour and a half before you can go to the ward. Once you go to the ward, we'll come to your recovery and rehabilitation process. Most patients typically stay for about 2 to 3 days after a knee replacement. But it is not about the number of days, it's about how your individual recovery goes and how soon you're able to get in and out of bed, go to the shower, and walk in the lobby. As soon as you, the nursing staff, and the physiotherapist all feel that you have fulfilled those criteria, you're confident and safe to go home, you can go home. Having said that, my preference is for you to recover at home rather than the hospital. And we have seen from our observations, and also we have got enough support from medical studies, that the longer you stay in hospital, the greater the risk that you might catch bugs and infections in the hospital environment. And hence, if you're ready to go home day 1 or day 2, then it is safe and good for you to do so. However, some of us may have to stay a bit longer if the recovery process is a bit slower. The physiotherapist would work with you starting from day 1 to help you get up and about, walk and perform exercises. I would strongly encourage you to stand up and sit out in a chair as soon as possible, if possible on the same day evening after the operation, or at worst the next day morning. The sooner you sit out in a chair, the better it is for your lungs to decrease chest infections, the better it is for the blood flow to decrease the risk of blood clots, and the sooner you start moving your knee, the better movement you get in the long term. I would also like to point out a caveat here. From the day one you start moving and exercising, pain and swelling are a part of the normal healing process. It is very important that you take pain medication as prescribed. I usually prescribe 2 to 3 kinds of pain tablets to be taken regularly, especially in the first 3 to 4 weeks. The more medication you take, the more comfortable you are, the more you are able to walk, and the more you are able to exercise. The physiotherapist will see you even after discharge on a weekly basis and progress through exercises. But it also depends on your time, your effort, and how seriously you take your exercises. You would need to perform them at least 3 times a day, spending about 20 to 30 minutes each time on the exercises. The surgery, the physiotherapy, all of this are one part of the whole recovery process. But the most important part of the whole process is how much effort you put into your recovery and rehabilitation as well. In most people, by 3 months, much of the pain and swelling has started to settle down. But it is only by about 6 months after a knee replacement that much of the healing process would have completed. And this process would continue for up to 1 year. And we have often seen that at 2 years, you are better off than what you are at 1 year. So it is a slow process, but in the initial 3 months to 6 months, the more you exercise, the more you spend time on your knee, the better the result you would get. I would like to talk to you about the risks involved with the surgery. This is not to make you nervous, but rather so that you are in the know and you understand what you are in for when you undertake this procedure. So the first thing that we are wary of is infection. Infection in a knee or a hip replacement surgery is a big deal, and we take a lot of precautions to avoid it. 1 to 2% of patients who undergo knee replacements worldwide can get an infection. And this percentage increases to 3 to 4% if you have diabetes. So if you do get an infection, then we'll have to do more operations to clean out the infection and give you antibiotics for a long period of time. In the worst case scenario, we may have to take all the components out, and then we have to do the surgery in 2 stages. In the first stage, we have to put in a spacer and bone cement that is loaded with antibiotics. And once the infection is controlled, we come back and then put in a new component in place. And over this period, you may need to receive antibiotics through your IV line. The second thing that we are very careful about is blood clots. After any knee or hip surgery, there is a risk of clots in your legs, and we take them quite seriously because occasionally these clots can break and clog up your heart and lungs, and very rarely this can be life-threatening. So the best way to avoid blood clots is for you to start doing your exercises, start moving your ankles, your knees, get up and about, sit in a chair as soon as possible. We also give you something called TED stockings. These are those white stockings you'll find that are applied before the surgery itself. It is desirable to have these stockings at least for 3 to 4 weeks. But if they are uncomfortable and cut into your skin, you can remove them after the first week. We also give you blood thinners. In most people, this would just be aspirin tablets, but if your risk is high, you may need to have injections to prevent blood clots. Next, so when I perform a knee replacement, there are big blood vessels and nerves in the back of the knee. Less than 1% of people may have injury to those blood vessels and nerves, but that risk is extremely low. Another thing you might notice after the surgery is you might see that there is a numb patch on the outer side of your knee, and this can be permanent. That is because there are small nerves that cross the knee from the inside to the outside, and we can't see them. And we make the cut for the knee replacement, these nerves are invariably cut. And that numb patch won't affect your knee replacement, and it's nothing to worry about. Our objective, or my objective, is to make sure that the knee replacement components will last forever. And most of them do. We have seen that about 90% of all the components will last for about 15 to 20 years at least. Overall, a vast majority of people have a very good result from knee replacement surgery and are able to have a pain-free knee, walk long distances, perform most activities at home and work, and play non-contact sport on a regular basis.